Daily English Lesson 17. At the doctor's office. Today's lesson focuses on English used at the doctor's office in daily life. Doctor visits can feel stressful, especially in a second language. Clear and simple English helps you explain problems and understand advice. In this lesson, we will learn useful vocabulary, common questions, and natural dialogues. Let's begin with the phrase, doctor's office. A doctor's office is the place where a doctor sees patients. Example, I have an appointment at the doctor's office. An appointment is a planned meeting at a specific time. Example, my appointment is at 10:30. Now let's talk about the word, patient. A patient is a person who receives medical care. Example, the patient is waiting to see the doctor. Let's introduce the word, symptom. A symptom is a sign that something is wrong with your body. Example, a fever is a common symptom. Doctors ask about symptoms to understand your condition. Now let's explore common symptoms people talk about. Headache means pain in the head. Example, I have a bad headache. Fever means higher body temperature than normal. Example, she has a mild fever. Cough means air forced out of the lungs suddenly. Example, I have a dry cough. Sore throat means pain or discomfort in the throat. Example, my throat feels sore. Let's explain the word, pain. Pain is physical discomfort in the body. Example, I feel pain in my back. Pain can be mild, moderate, or severe. Now let's talk about how doctors ask questions. They often begin with, what brings you in today? This question means why you came to the doctor. Another common question is, where does it hurt? Doctors may also ask, how long have you felt this way? Let's look at a short dialogue. Dialogue 1, checking symptoms. What brings you in today? I have a sore throat and a fever. How long has this been going on? For about 3 days. Let's explain the phrase, going on. Going on means happening or continuing. Example, the pain has been going on all week. Now let's talk about describing time. For 1 day means 24 hours. For a few days means 2 or 3 days. For a week means 7 days. Clear time descriptions help doctors diagnose problems. Let's introduce the word, medical history. Medical history is your past health information. Example, the doctor reviewed my medical history. Doctors may ask about allergies or past illnesses. Let's explain the word, allergy. An allergy is a strong reaction to something. Example, I have a peanut allergy. Doctors need to know allergies before giving medicine. Now let's talk about examinations. An examination is when the doctor checks your body. Example, the doctor did a quick examination. They may check your temperature or blood pressure. Let's explain, blood pressure. Blood pressure measures how strongly blood moves through your body. Example, my blood pressure is normal. Now let's talk about tests. A test helps the doctor find the cause of a problem. Example, the doctor ordered a blood test. Tests can include blood tests or X-rays. Let's explain the word, X-ray. An X-ray is a picture of the inside of your body. Example, the X-ray showed no broken bones. Now let's talk about treatment. Treatment is the way a doctor helps you get better. Example, the treatment worked well. Treatment may include rest, medicine, or therapy. Let's introduce the word prescription. A prescription is an order for medicine written by a doctor. Example: the doctor gave me a prescription. Some medicine requires a prescription. Let's explain over-the-counter. Over-the-counter medicine can be bought without a prescription. Example: you can buy this pain medicine over the counter. Now let's talk about dosage. Dosage is how much medicine you should take. Example: follow the dosage instructions carefully. Doctors explain dosage to avoid side effects. Let's explain side effects. Side effects are unwanted reactions to medicine. Example: drowsiness is a common side effect. Now let's explore another realistic conversation. Dialogue 2, Receiving Advice. You should rest and drink more water. Do I need medicine? Yes, I will prescribe antibiotics. How often should I take them? Twice a day for 7 days. Let's explain antibiotics. Antibiotics are medicines that fight bacterial infections. Example: antibiotics help treat infections. Now let's talk about follow-up visits. A follow-up visit is another appointment after treatment. Example: please schedule a follow-up visit next week. Follow-up visits help doctors check progress. Let's talk about the phrase, feel better. Feel better means your condition improves. Example: I hope you feel better soon. Now let's talk about emergency situations. An emergency is a serious and urgent medical problem. Example: call for help in an emergency. Emergency rooms treat urgent cases. Let's explain emergency room. An emergency room is a hospital area for urgent care. Example: he was taken to the emergency room. Now let's discuss polite language at the doctor's office. Speaking clearly and honestly is important. Doctors are there to help, not judge. Asking questions is encouraged. Let's talk about common concerns learners have. Many people worry about vocabulary mistakes. Simple words are usually enough. Doctors understand non-native speakers. Now let's practice a longer dialogue. Dialogue 3, Full Visit. Hello, please have a seat. What seems to be the problem? I've been feeling tired and dizzy. Do you get enough sleep? Not recently. I recommend rest and blood tests. Thank you for your help. Let's explain the word dizzy. Dizzy means feeling unsteady or lightheaded. Example: I felt dizzy after standing up. Now let's talk about health advice. Advice is a recommendation to help you improve. Example: the doctor gave helpful advice. Following advice helps recovery. Before we finish, let's talk about why this lesson matters. Dr. English helps protect your health. It gives you confidence in important situations. Now let's move to the review section. Review section. Key points from Lesson 17. Key vocabulary includes appointment, patient, symptom, pain, treatment, prescription. Common symptoms: headache, fever, cough, sore throat, dizziness. Useful questions. What brings you in today? How long has this been going on? Do I need medicine? Important concepts explained: medical history, allergy, dosage, side effects. Dialogues covered symptom description, treatment advice, and full visits. Clear and honest communication helps doctors give better care.